So on this next procedure, I'm going to be working on releasing the femoral nerve. There's a lot of different ways we can do this, and there's a few things that we need to pay particular attention to. The femoral nerve is extremely important for basically function of the whole hip flexors. If you have a compressed femoral nerve, you may notice the iliacus and psoas muscles are actually not engaging the way they should. Can you lie on your back for 1 second here, Minnie? If I was to test hip flexion, bring your leg up here, like so. I'm gonna push down here fairly hard. Just try and resist. Yeah, there we go. One more time, hard, hard. There we go. Okay. So in your case, for whatever reason, it's not engaging quite the way it should.
Yeah.
Okay. Let's say we turn back over on your side. So actually, before we do that, just have a seat for a second. So put some towels up into here. We're going to do a little femoral nerve release. This may or may not have the result of strengthening that area, but we'll check it out and see what happens here. Okay. Let's have you lie on your side here. So in this general procedure, I'm going to get you to do a few things here. We're actually going to try and floss the nerve. I'm going to get you to bring your head back and your arm up. So this is the first part here and down. So when you bring it up, like you want to really stretch back, bring that back. Does that feel okay?
Oh yeah.
Good. At the same time that you're doing that, we're going to get you to bring your leg back like this. So do those two motions together. So it's best to train your patient how to do this, even though Mickey already knows how to do it. Let's bring this back. Good. Doing okay there?
Oh yeah.
Fine. Okay, so I need to access the area here. Very sensitive area. First thing, get permission to work on the area. You okay with me working on the area here?
Okay.
Okay, so I'm going to kind of work my way in here. Now, we've got the inguinal ligament along here, and what you're looking for, you want to make sure you don't have a pulse in here. Okay, because the nerve is just lateral to where the artery is. Now, I don't feel too much in here. Is it okay if I just actually reach in here and actually get direct skin contact against there? Okay, so I'm going to get on here. 1 second. Sometimes it's really important to find out. There. Okay, now I can feel the pulse. I'm going to go a little bit lateral from there. So I know I need to be on that area right there, okay?
Okay.
So what we're going to do is we're going to take some pressure on here, but I don't even know I'm actually even close to where the psoas muscle is. Bring your leg back here. I'm going to bring the hand down here. Move the omentum or the intestines out of the way, and then I'm going to get you to push up against my hand here. Okay, no, let's go again. There we go. We got it there. It has to be really obvious to you where these anatomical structures are. So I'm going to get in there, and I want you to do those motions. So bring your arm up and head back at the same time. Good. Doing okay there?
Yeah.
And back. Bring it in. Okay, real slow. And again. Back. And I'm just going to help out here a little bit. There we go. You okay?
Oh yeah.
Feel that a lot more?
Yeah, way more.
Okay, back. I didn't feel too much until I actually got a little more range on there. Good. Now, the number of times that I'll perform this procedure will be dependent upon when I start to feel this give way and start to loosen up a bit. Because it's really tight and contracted, it doesn't make much sense to just stop after 3 passes. You've got to feel a change in the tissue. And back. Good. Okay, let's just have you lie on your back again. Get this out of the way for you. Bring this up here. Okay. Resist real hard. Hard, hard, hard. Come on, hard. Okay. So, it doesn't mean that you had femoral nerve entrapment.
Yeah.
Because I was actually taking some restrictions out of the psoas at the same time.
Okay.
People who sit for long periods of time, this muscle gets very short and contracted. That could have a huge influence on not only hip strength, leg function, but low back pain. Mm-hmm. So this is a really important procedure.